Hello, welcome everyone to the Monday Lunchtime Digest for February 10th, 2025. Happy Monday, Hayley.
Happy Monday, Micah. I like your hoodie.
Oh, thank you very much. Yes, I'm sporting the Retread hoodie. Hayley and I were talking about it just before we got on the Lunchtime Digest here. So, if you're not familiar with Retread, it is a thrift store that is run by um,
Hope is alive.
Hope is alive. I knew there was a
Yes.
hope in there. I would have been able to tell you any other time except whenever I'm on camera. Hope is alive. So if you're not familiar with Hope is Alive, they provide substance abuse support groups, and also for not just for people that are on their sobriety journey, but also for friends and family as well. So certainly check out Hope is Alive. And then if you'd like to support them by going thrift shopping, then show up to Retreads. They have a lot of great stuff there. And also, as you start thinking about doing some spring cleaning and things like that, it's also a great place to go donate your things as well. So, yeah, certainly check them out. So, yes, I'm sporting that today, and free for nothing. I'm sporting their merch, free for nothing. So, Hayley, tell us what's going on with the Oklahoma Counseling Institute.
So first of all, I have repped many of my Retread sweaters on here too. I just haven't made a declaration. So I've also repped the Retreads. It's a great organization. But through the Oklahoma Counseling Institute, we have a lot of exciting things coming up. And so, first of all, if you missed our legislative town hall last Wednesday, you missed a wonderful, engaging conversation that not only empowered us to advocate as mental health therapists, but also collaborate across the disciplines. But if you did miss that, that recording is now up on the Oklahoma Counseling Institute website. And so the recording is members only, but it is free. And so if you're not a member, you can go to you can go to counselinginstitute.org, sign up for membership. And again, that's free for the first 30 days. But the conversations that we had, so in our legislative town hall, we talked about, I guess, 8 or 9 different bills, Micah. We had quite a few bills that we discussed where we talked about not only what bills are coming up this legislative season, how they might affect us mental health therapists or our clients, and what we can do if we are pro those bills, against those bills, or have some more questions about those bills. And so I thought it was a really engaging conversation. I know I learned a lot personally, not only from going through the bills, but hearing the representatives talk about them. So we had representation from the Oklahoma Counseling Association, Oklahoma Psychological Association, Oklahoma Psychiatric Physicians Association, Case Management Society of America, and Healthy Minds Policy Institute. And of course, Mike and I were there as well, giving our 2 cents. But go check that out, counselinginstitute.org, and find that recording now. We also have a few trainings coming up. And so starting on March 1st, we'll be kicking off our latest and greatest training season at Halo Project's new location. And so Halo Project's new location is going to be located not too far from the old location, but whenever you register, you will get an email with the new location's address. And so this year, what we're starting off with is in the morning, motivational interviewing for substance abuse treatment. So that'll be 3 hours of drug and alcohol specific CEs. And in the afternoon, I'll be doing my first ethics training of the year. So I'll be doing an ethics training on what to do if you have multiple careers that you're doing as a counselor. So how to, one, start other careers with our LPC, whether that is consultation, whether that is maybe we're doing classes of some sort, but also how do we ethically keep those careers separate and also protect our license in all of those careers. And so we'll also have another round of trainings on April 5th. And so really, really excited to welcome Shelly Maddox on Introduction to Gottman Therapy. That's one I won't be there live for, but I'm excited to review the recording because I've always wanted to learn more about Gottman therapy. I know, Micah, you've talked a lot about Gottman as we've consulted with each other over the last few years. And so I'm really excited for all of the trainings coming up. I know I'm a little biased because I'm one of them, but I think it's going to be a really great lineup this year.
Yes, yeah, really looking forward to those trainings coming up because it will be the beginning of our workshop season whenever we're doing the in-person workshops starting there in March. And we do that in March, April, and then in May, we have our Summer Super Summit that is coming up. And then also finishing off in June for our in-person thing. So if you are interested in in-person trainings, then certainly check us out. All these are recorded and will be put online for our on-demand courses as well. So a lot of exciting things happening. So Hayley, what's going on in the world of mental health right now?
So, a couple of things. So, on the Oklahoma level, one, the Oklahoma State Department of Health has started back up their mobile wellness units. And so, the mobile wellness units are basically little doctor's offices that travel all across the state and do some basic exams, basic testing, basic medical care. And so, right now, the state of Oklahoma is the highest, if not one of the highest, hotspots for flu. And, and talking to some of my clients and some of my colleagues, it's problematic right now whenever folks don't have insurance coverage. It's the beginning of the year too, so maybe folks aren't ready to pay those out-of-pocket costs. And so if you're needing just some medical care, if you have some clients who need some medical care, they can go to Oklahoma State Department of Health.gov and then search the mobile wellness unit, select your county, and it'll show you when the mobile health unit will be in your particular county. And so I just looked earlier, and this week they're in Lawton, they're in Elk City, they're in, I think, Clinton, they're in Tulsa. So they're all over the state at all times. They won't necessarily be in every county every single week, but you can go to that spot and see if they're in your county or surrounding counties. And so that is free, provided by the Oklahoma State Department of Health.
Oh, fantastic.
Yes. I like free.
Yeah, free's good.
Yeah, free's good. And then nationally, I guess internationally, there was a study that just was published by the University of Hong Kong, which explored the relationship between loneliness and depression. And what they had found was that is actually the feeling of loneliness rather than actual loneliness that is linked to depression symptoms. So they looked at 900 adults over a 2-year period between 2021 and 2023, so during a lot of the COVID lockdowns. And they found was that specifically those who often thought about being alone or thought often about being alone, or they focused on how lonely they were, the more often they focus on those two components of loneliness, the more depressed they were, regardless of how lonely or isolated they actually were. So really the biggest component is thinking about loneliness contributes to mental health rather than actually being lonely. And so what the researchers suggested is, if we are working with folks who are lonely, to look at that cognitive component first, to see if we can alleviate symptoms that way before we even start to talk about connections and whatnot. Because even if they do make those connections, they still have that cognitive component that they're still lonely, then that might not necessarily decrease depression as much.
I see. And so really looking at the difference between being alone versus being lonely and depressed.
Yes.
Right?
Absolutely.
Yeah. And so, I mean, as you say that, it makes me think of one of my clients who is retired now, but he is an introvert. And so I'll ask him about social contact with friends and things like that in the community. And one of the things I frequently ask him is, are you having as much social contact as you want, or are you wanting more, than you have? Or are you happy with the amount that you have? And so even though he may go out and see friends like, once a month, he is perfectly happy with once a month. Like he really doesn't indicate that he would want to do anything more than that. So I think that that's really a good thing to look at when talking with especially like our older clients who are maybe more isolated, as you're saying, to see is that perfectly okay with them, or are they feeling depressed because they're not around more people?
Absolutely. And I like the way you phrase that. Are you getting as much social contact as you want? Because that can vary widely. I think about my spouse and I during COVID. I'm very much an extrovert and he's an introvert. And during COVID, like it was a scary time, it was an anxiety-provoking time, but he was perfectly content just sheltering in place and, not having social obligations. And me, I was probably on a phone with a different friend almost every other day, just walking around the neighborhood, catching up and having that social contact. And so it's interesting just to see the differences between folks. So yes, I like that.
Yes, definitely. All right. Well, thank you for that, Hayley. I really appreciate it. And, talking about, again, what's going on in Oklahoma with the Oklahoma legislation session and things like that, you can go to counselinginstitute.org and follow our legislation tracker and see where these different bills are in the process. One of the things, a couple of the bills that got a lot of attention was one by Justin Humphrey, House Bill 1343, which sought to end the Oklahoma Department of Mental Health and Substance Abuse Services and put it under the Department of Corrections. And so he has since withdrawn that and has basically made the statement that he really just did it for attention, to bring attention to the lack of mental health services for people in the jails, which I think that we all can agree that there's mental health services are needed in jails and prisons and things like that. I don't know about the strategy of creating a bill to get everyone all worked up to get attention for that, but maybe they have much better. I'm not in the Oklahoma legislature, so maybe they have much better idea of strategy and things like that than I do. But that is now been withdrawn, so we don't have to keep an eye on that one. And then the other one is Senate Bill 1017 by Dustin Devers, which was going to end student services in schools. And so he withdrew that one. And there was, a lot of debate on if that would even be legal for him to do, because you are required to provide services for students, who are disabled and things like that with the American Disability Act and that type of thing. But he is, wanting an audit of services to make sure that spending is done, wisely and appropriately and things like that. But, and I don't know if there's any correlation to this, but I know that there was a big change.org petition that was being sent around that got something like 3,000 signatures on it. And so he said because of all the outcry that he got from parents, advocates, and things like that, that he was withdrawing the bill. So things like that work. So if there is a bill that you are really, really concerned about, then on our legislative town hall, which, as Hayley said, is recorded, which members can watch now, talked about calling your representative, emailing your representative, or even, they didn't mention it during the town hall, but even starting one of these change.org petitions, getting it sent around, on the internet for people to be able to sign. That seems to get these representatives' attention and has an impact on some of these bills.
Absolutely, it does. We have more power than what we think sometimes, especially when we band together.
Yes, definitely when we band together. And so I think that there's some of these bills that I know, as we were talking about in the legislative town hall, that all the organizations, of course, some of them have their differences, things that they want that the other group doesn't want, but there's certain ones that we all agree are not a good idea. So if we all band together as mental health professionals and as Oklahomans, then we can certainly send a message to the Capitol that we don't want these bills.
And we just got a comment from our friend Kira Morris, who said, we need the voice way more. I agree. It's, part of our role as mental health clinicians and those who work in the mental health field. Advocacy is a big part of that, right? It's our duty to stand up for our clients and to make sure that everyone's being treated ethically and fairly and getting the services that they need. And this is just another way for us to do it. We do that on the individual level as we help clients get connected with services or help them in the therapy room or help them find the right referrals. But on a major scale, this is our time to shine during this legislative season.
Definitely. And, that's one of the things that we're wanting to do at the Counseling Institute is to be able to provide easy access to information so that Oklahoma mental health professionals in particular can go to our website, track these bills. They're going through the legislative process, and then know which ones to act on and things like that. And of course, work with your state organization as well on being able to direct your efforts, but just to try to provide that information to more Oklahoma mental health professionals.
Absolutely.
All right, Hayley, who is our weekly winner this week?
So our winner this week is our old friend, Amy Hoisman. Yay, Amy.
Hey, Amy, congratulations. I think Amy is one of our top winners of all time. And so Amy has won an on-demand training.
Yes, she has won an on-demand training. So Amy, if you'd like to send us an email, hello@edmondcounseling.com with which course you would like, then we'll get that assigned. Of course, you can find all of our courses on the counselinginstitute.org. Click on the CE tab, and you'll find all of our on-demand courses there. But if you're interested in learning about any of our on-demand courses anyway, maybe just to take some courses yourself or to hopefully win next week's drawing, you can still go to counselinginstitute.org, click on the CE tab, and find all of our on-demand courses there.
And if Amy has the same amount of luck this year she did last year, she will get all of her CDs for free. I mean, it's very possible that someone could get them all for free. So as Hayley says, in order to enter, like, share, comment, and you'll be entered into the drawing.
Yes. I think Amy is our third Amy to win this year too. So our friend Amy Brewer has one, and I think another Amy has one. So Amy's just like the lucky name this year.
Well, fantastic. Well, all you Amy's and non-Amy's, certainly like, comment, and share. So Hayley, what is our question for this week?
So our question for this week is twofold. It is, did you watch the Super Bowl? And if so, what was your favorite commercial? And so I want to ask you first, Micah, did you watch the Super Bowl? And if so, what was your favorite commercial?
I did watch the Super Bowl. I stopped about somewhere in the third quarter. It was pretty brutal, and I think people that watched it were either really happy or really not so happy. But my favorite commercial, I have to say, was one of the first ones that came on with the Martha Stewart dancing commercial. And
Ah,
so that one was funny. I really liked. And then the other one I really liked was the seal commercial with Seal's face being on a seal, which I thought was pretty outrageous. Did you see that?
I did not. I actually did not watch the Super Bowl.
Oh, you didn't? So, like the
No.
first one, I can't remember what the Martha Stewart commercial was about, which I know I'm sure the advertisers hate that. The Seal one was a Mountain Dew one. I do remember that one, but
Oh, that's
those
good.
were those were my two favorite commercials. So, have
Oh.
you, Haley? You didn't watch it?
No, I watched a Led Zeppelin documentary in theaters.
Oh, okay.
No, that got me tickets to that. I actually forgot the Super Bowl was yesterday until I checked social media this morning and said, "Oh, I guess I missed something big."
There it was. You're wondering why no one else was in the Led Zeppelin
Yeah,
theater, huh?
it's just me and a bunch of folks much older than me, but that's
Yes, I
okay. We
bet.
had a great time.
Old hippies watching it.
Yes.
Yeah.
Yep. And so tell us, folks, tell us in the comments, did you watch the Super Bowl? And if so, what was your favorite commercial? And every time you comment, you like, or you share this post, you get entered into a chance to win next week's drawing. And you also help us grow, help us be seen by others. And so thank you so much for your support.
Yes, thank you for your support. And as always, anytime that you like, share, comment on this post, you tell your friends or colleagues about us, you attend one of our in-person workshops on demand or watch one of the on-demand trainings, you're helping to meet the mission of providing quality continuing education in Oklahoma. So thank you guys so much for that. We appreciate it.
Yes, thank you so much. And you all have a wonderful week.
All right. Bye, everyone.